For any staff that are undertaking home visits, where possible, always plan in advance. You can contact the patient, establish if they have any symptoms of COVID-19 or if anybody in their household has symptoms. Then you can plan your visit in advance and make sure that you take the appropriate personal protective equipment with you. It's ideal for 2 people to visit a house. This way you can support each other to ensure that you are putting on your PPE correctly, removing it correctly, and you can plan the visit accordingly. For staff carrying out home visits, there are unique challenges that you need to consider. For example, in advance, where you can, contact the patient, as I've already mentioned. When you get to the house, ensure that you stand 2 metres back when the person answers the door. Ask them to provide you with a clean towel and soap so that you can wash your hands afterwards. Ask them to go into a room and close the door so that you can put on your personal protective equipment away from the individual. Then you can commence with the visit. Again, at the end of the visit, you will need to ask the patient to remain in the room so that you can leave and remove your PPE safely in another area of the house. Once you've removed your personal protective equipment, you will need to place it into the clinical waste bags provided and tie it securely. Then place it into another bag and tie that bag. The national guidance indicates that you can then leave that personal protective equipment and the bag in the person's home. It can be left for 72 hours and then can be discarded in the person's own waste bin. Under no circumstances should you remove any used PPE and take it in your car to dispose of. This poses an infection risk. If you do not feel that you have adequate hand washing facilities in the person's home, please use hand gel and then immediately, as soon as you are able to, wash your hands with soap and water after leaving the home. Use safe work practices to protect yourself and limit the spread of infection. Keep your hands away from your face and your PPE being worn. Change gloves when they're torn or heavily contaminated. Limit surfaces that you touch in the patient's environment. Clean your hands after removing gloves and regularly perform hand hygiene. This video demonstrates the A-lift technique. This technique should be used every time you wash your hands. We will need to increase the frequency of our hand hygiene, particularly before and after going in to see a patient, before putting your PPE on, after removing your PPE, and at regular points throughout the working day. If you do not have immediate access to suitable hand washing facilities, please decontaminate your hands using hand sanitizer, and then as soon as you have the opportunity, you should also wash your hands with soap and water. Before you put on your PPE, make sure you are well hydrated, tie your hair back, remove any jewellery and check PPE in the correct sizes available. What you should put on is a plastic apron, which you should tie securely. After you have put on your plastic apron, you will then need to put on a surgical face mask. To wear a surgical face mask, you should position the upper straps on the crown of your head, above the ears, and the lower strap at the nape of your neck. Mould the nose piece from the bridge of the nose, firmly pressing down both sides of the nose with your fingers until you have a good facial fit. Finally, you should select a pair of gloves according to hand size. It's important to remember that the outsides of the gloves are contaminated. After removing your gloves, clean your hands with alcohol hand sanitizer. Next, you should remove the plastic apron by pulling it away, touching the insides only, as the outside of the apron will be contaminated. Bundle it up and discard it into the waste bin. Do not touch the front of your mask when removing it, as it will be contaminated. Reach to the back of your head and undo the straps, or pull them to rip them. Let the respirator fall away and discard it, only holding onto the straps.